Good afternoon. Thank you very much. I am really honored to be here this afternoon, and I would like to thank the University of Texas and the School of Public Health, and also the Dell Foundation for this support, and in particular Dr. Dina Holscher, Dr. Steve Kelder, Cheryl Perry, and Dr. Bill Cole of the Executive Committee for selecting me and giving me the opportunity to talk to you about our work in the Institute. Finally, to Julie Lachman and Tiffany Mendez for the organization, and to all the faculty and the team in the University of Public Health for your support. So this is my institute. This is like the main logo of our institute in Cuernavaca. And I am going to talk today about what Mexico, what the U.S. can learn from Mexico's battle against obesity. And what is obvious is that we have learned a lot about what the U.S. is doing, but maybe it's not so obvious what you can learn from our experience. And I will say not only from Mexico, but from Latin America. There are a lot of things happening in Latin America, and Latin Americans are very connected. I think it's very organic because maybe of the language and because of some cultural aspects, and we are having some success in some of the interventions and policies that we are doing. And this is a very long list, but I would like to recognize a lot of collaborators from the Institute and also from abroad that have supported us and helped us to do a lot of the evidence that I will show, and that is becoming important to try to battle obesity and chronic disease in Mexico. And this is the first slide I want to show you. This is about a paper that we did on mega countries that have more than 100 million inhabitants. And within this group, there is, as you can see, most have a very important mortality, cardiovascular disease and diabetes mortality. So this is not anymore a problem of countries that are very developed, but it's becoming a very important problem even in countries with medium and low human development index scores. And if you see Mexico and the US, they both have a very similar aggregated mortality of cardiovascular disease and diabetes. However, from all this list, the country that stands out with the highest mortality of diabetes is Mexico. It's very different to all the other countries, and this is very interesting and it's very important because it's something that happened in just 2 or 3 decades, as I am going to show you. This is a publication that has the prevalences of obesity around the world in many countries, and we participated on that publication. And as you can see here, Latin America has most of countries in Latin America has a prevalence of obesity above and overweight and obesity above 50%. And as you can see, Mexico, United States, Chile, and other countries have a very similar prevalence. So this is a problem that is also very frequent in Latin America and in these countries. And this is one of the first analyses I did when I was returning from my PhD to Mexico. I was describing mortality, which is something very simple that you can do if you learn some techniques. And so I did my adjustment for the population and for age, and then I put the US as a comparison just to know how were we doing with diabetes mortality. And I had a lot of troubles publishing this paper because it was viewed with a lot of skepticism by reviewers, not only national but international. Everybody knew at that time that the US was facing a diabetes epidemic, but nobody believed that we were so high and with a higher, more inclined slope in the mortality due to diabetes. So finally it was published, but they asked me to put here a note that this was a change of the international classification of diseases, and also to smooth the trend line, so not a linear trend, but to smooth, and to recognize that some limitations may have probably overestimated the mortality, such as the classification, the mortality registers in Mexico, and also some adjustments. Now I'm going to show you what, after 10 years, the trends in mortality in Mexico. And this is, the red one is diabetes mortality. We confirmed that there was an inflection point in the end of the 90s. And now diabetes is the #1 cause of death. In only like 10 years period, it became the #1 cause of death in Mexico. Other causes of death are cardiovascular disease, strokes, cirrhosis, and chronic obstructive pulmonary disease. So all of them are related to lifestyles, and this is sad, but also it's an opportunity because we know we can do better, and we know all these problems can be solved or not solved, but improved with some interventions. And this is how it looks right now, the contribution of diabetes to general mortality in Mexico. And as you can see, from America, we are the #1 country in diabetes mortality, and one of the countries in the world with highest diabetes mortality. But it's not only diabetes mortality. We have also, as you know, a big problem of undernutrition, as many other countries in many other developing countries that are of middle and high human development index, so like India or Brazil, we also face undernutrition problems. So Mexico was usually always directing their efforts to overcome undernutrition and not that much paying attention of chronic diseases. And as you can see here, there are a number of mega countries that are still in the stage of transition in which their main problem is undernutrition, and this is an indicator. Stunting in children under 5 is an indicator of chronic undernutrition, so they are very high. They are above 10% of prevalence of stunting. And then there are countries that are very overweight in the mega countries, such as Mexico, Brazil, Russia, US. And here is Mexico. Mexico has still a lot, more than 10% of child stunting, but is one of the mega countries with highest prevalences of obesity. So we have this double burden. And the recent trends also show that these are not opposite problems necessarily. So they have sometimes common determinants, such as breastfeeding. Breastfeeding in children promotes adequate growth and protects of stunting and chronic undernutrition. And it also protects children of becoming obese or with diabetes in later life. So what happened in Mexico? When I started working in the institute, we collected the second National Nutrition and Health Survey, the 99, and we had one before that. So I am going to show you now the trends in the distribution. This was in 88, then 61% in 99, then 69, and in 2012, 71. We just collected 2016, and it has not increased a lot, just look a few points, and it was not, it was within the same confidence interval. So we conclude that it's not increasing anymore. It seems that we have reached saturation equilibrium. But the important part is that we increased a lot in the from 1988 to 1999. So in 11 years, we almost doubled the prevalence of obesity. At that time, obesity was not even perceived as an important problem. I was one of the junior researchers at my center, and they assigned this topic to me because they were concerned with the very important things such as undernutrition, macronutrient deficiencies, etc. So when I showed the information to my bosses, they sent a team to check all my calculations because they didn't believe, they thought something was very wrong, and then it starts to get a lot of attention from decision makers. We were talking with groups, with congressmen, and one of the things they told us is you need. Also, we had a workshop with the NIH of United States. So one of the recommendations is go immediately and try to look at other data sources to try to identify what things in environment might explain this change. Obviously, we tried. We do not have any large cohorts or very good information, but we identified the household income and expenditure surveys that the Ministry of Economic do every 4 years, and those had expenditure in foods. So we did this analysis, and this was in part with support from Barry Popkin, who has been here in this same lectureship, and he helped us to do this analysis. We do the adult equivalent estimation, and we find that about 40% increase in this period in sugar sweetened beverage consumption, with important decrease in other types of foods. And obviously this is not the best evidence to do policy, but we started since that time, since 2000, 2001, 2002, to speak with lawmakers, and we immediately thought that maybe soda tax will make all sense to reduce consumption, but obviously this was disregarded as not adequate evidence for this kind of policies. Later on, as you can see from this study made with information from industry, we know now that sugar sweetened beverage is something that Mexicans consume a lot. We are one of the countries with highest consumption per capita. I don't know in ounces, but it's like 165 liters per capita per year in Mexico, which is huge. So I'm going to talk to you a little bit about the obesogenic environment in Mexico. I will talk about food access, food and beverage marketing, school environment, active transportation and community spaces, and vulnerable populations. But I'm going to show you pictures, just so you get a sense of what we are living. And the main question is for obesity, is a social responsibility or is individual responsibility? Because we are very used in health sciences, well, not in public health, but in health sciences, to say this has to do with education and with lifestyles and with people have the responsibility of eating healthy. But the truth is the environment is very problematic, and we are living that every day in Mexico. Right now, many problematic aspects of obesity are seen as normal in Mexico, and I am going to show, but we recognize that environment affects lifestyles, and the proper environment is necessary to adopt healthy behavior. So it's not only individual responsibility, but a complex problem that has many actors involved. So this is now a common view. When I was a kid, I only see this when I travel in vacations to the States. But now this is common in Mexico in most supermarkets, and all the food distribution is now in the same chains. We have Walmarts and Costco and all these big supermarkets, and this is the environment in which people is purchasing. These are very large sizes. We have 3-liter Cokes and soft drinks, and usually they are always on discount, or they give you free chips when you buy more than 3 or 4 of these bottles. Also, there is no regulation of how do you distribute foods and promotions in the supermarket. So you see this all the time. This is normal in Mexico, and you can imagine what happens with this kind of situation. Like if a family with a very limited resources go to buy some fruit, just a small portion of fruit because has limited resources, and there is a great offer and they will give you 3 instead of 2 for the same price, or they give you a bucket. They have all these kind of strategies. You probably will end up buying soft drinks instead of buying what you were supposed to buy, and many other distorted strategies, such as what you can see here, like very big large portions of sugary water that is marketed as frutal with vitamins and more flavor, and this is 10 liters, and it costs less than $2. And it's full of this, and I don't know, but maybe in some supermarkets, sugar sweetened beverage occupy like 40% of the space. But not only that, also misleading marketing directed to children is very common. So this is like a down. Many parents don't even see it, and then suddenly the kids is crying because they want this kind of chocolate. So this is very common, and the WHO and the Pan American Health Organization have made the recommendations to stop doing food marketing to children, and it's still very common in the country. What you see outside the supermarkets is very similar also. The corner stores that used to sell ingredients to make food at home have transformed a lot. So now we have a lot of sugar, sweetened beverage, and unhealthy products at very cheap prices all in the country. So there is a very good access to this type of foods. Nothing here is, or most of these products are not fresh products and healthy products. And the school environment is very problematic. We don't have these full-time schools like here with a kitchen. We have schools that have shifts that last 4 or 5 hours. Some schools have 3 shifts, so they have morning, middle day, and night shifts with different students. So there is very little time to interact with kids at schools, in public schools. There is no kitchen, so this is more or less what they can buy and eat. And there is very limited time to do some physical activity. In particularly when we see the evaluations of curriculum between countries, Mexicans need to learn a lot of mathematics, physics, biology in these 4 hours. So there is no good chances that to increase physical activity education or to make a kitchen to have the children eat for 40 minutes or 30 minutes is something that is not happening. And outside, also in the public parks, this is a picture of one of the main running parks in Mexico City. And as you know, when you are 2% dehydrated, you only think on drinking something. And it's full of advertisement. Also, the bike lanes in the city are full of advertisement. And the sport teams that are very full of soccer is very big in Mexico. And all the sport teams have junk food or beer advertisement. So that's very common. The kids are wearing these t-shirts since they are very young with a lot of pride. So this is problematic. But maybe the saddest part of all is what is happening in rural, very poor communities. Also, we are having a lot of marketing practices that are really unethical. They are sponsoring even like the government, the local small government. So most of the welcome letters, welcome ads in these towns are sponsored by Coke, even in the language of the community, in indigenous languages, and they have basically no information. Sometimes they don't know how to read, and they don't know the effects of soda on health. Sometimes they do not know what is diabetes. But this is the sector in Mexico that has the highest growth in mortality due to diabetes and chronic disease, and also they have an epidemic of dental health and dental caries due to these practices. So this is what we are facing in Mexico. So the 3 basic prevention premises that I will mention is nutrition education cannot solve alone the obesity epidemic, as you know, and this is very strong in nutritionists in Mexico. Anytime we talk about taxes, they say, oh, no, the taxes is not for nutritionists. Nutritionists, we want to solve this with education. Or when you go to a diabetes meeting, they say, we need to learn how to educate people. But we think it's not only education. The obesity epidemic have a structural determinants such as political environment, culture, economic environment, and others. And also, obesity requires a complex solution with multiple actions, and society is responsible. That's other problem in Mexico. Big part of sector of the society thinks this is something that the medical and health sector needs to solve. So they say, you are not giving results, you are not doing well your work because this is increasing. And in reality, this is like environmental global warming, and it has a lot of interest from many agencies. So I am going to show you some of the evidence we have developed to make some obesity policies. And this is not very advanced on research. It's not research that has cost millions of dollars or big cohorts. It's, most of the times it's very simple characterizations of what we are experiencing in Mexico that we combine with research that has been developed in developed countries in in cohorts, and so sometimes we take the relative risk of becoming diabetic in a big study or meta-analysis in an international journal, and then we apply that to the situation in Mexico to estimate the projections of diabetes, these kind of studies. So first, this is an article by Michel Cecchini in Lancet, in which he modeled for different countries of Latin America which could be the best opportunities, the low-hanging fruit of policy to prevent obesity, and they identified these ones. And when I saw this one, I was like, okay, this is also very useful to promote the soda tax, because they are saying in Mexico, its tax intervention is very low cost and is cost effective. Later on, a few months when I talked with Michel, he was using this thinking on tax interventions on fat, but anyway, it was very, very useful because the tax is a very low-cost intervention, and it has also other components that we think are very useful. One of the first things we did is try to model elasticities of price elasticities of consumption of soda. So we published this paper in which we demonstrated that a 10% increase in the price of soda could reduce 50 milliliters the consumption of soft drinks. At that time, we didn't know that it was better to model it with kilocalories. So we did it with milliliters, but still, since then, other papers have find the same elasticity. So soft drinks are elastic. You increase price, consumptions go down, and that was the model. And this also was very useful. We went to speak to the Congress in 2008 with the paper and say, look, this is important. We probably should have a soda tax. Also, from the national surveys, we were able to describe, so this is also descriptive epidemiology, we were able to describe by age group the consumption of soft drinks and sugar-sweetened beverage. And as you can see here from this estimation, for most age groups, the calories consumed per day, on average, are like equivalent to 20% of the whole energy in a day from sugar-sweetened beverage. And the human did not evolve to have calories in drinks, only like in very early infancy, but we are not made to drink calories. So what happens is you don't adjust your appetite for drinks. So you can drink a soda and then have a burger, and that is not the same effect as if you eat 200 calories and then you have a burger. So it makes you eat more and have more calories in your system. Other problems is marketing, and we have explored marketing of unhealthy foods on TV, on open TV, and in this study we recorded 13,000 ads, and about 1/4 of those are of the food industry directed to children, and mostly of unhealthy foods such as savory snacks, ready-made foods, soda, sugar-sweetened beverage, chocolate products, etc. So there is a lot of unhealthy food marketing exposure. We were, when we made this report very early, a lot of time before this was published. Actually, we were talking with the equivalent to the Mexican FDA, that is called COFEPRIS, and asking them to do some kind of regulation of industry. And industry say, no, wait, we want to do our own pledge and self-regulatory code. And they made a pledge to regulate themselves and to do not produce unethical marketing to children on TV. So they placed this, and we evaluated it, and they created, it was very easy to follow, it was not in agreement with the Pan American Health Organization recommendation, and still they didn't comply with it. So one of the lessons is self-regulation of marketing to children doesn't work, and we know that also from studies in the US, from the Roth Center, from Dr. Kelly Brunel and other groups. So we just confirm what we already knew from the international literature. Self-regulation was bad. We had advertisement in cartoons, then in soap operas and sports, and many other aspects that children tend to watch a lot. And also due to the insecurity in many places of Mexico, children are watching an abnormal amount of hours of TV, so they are even more exposed. So one of the big chances for us came in 2009 and 10, where the Ministry of Health asked us to develop consultation and a systematic review and expert meeting to identify opportunities to prevent obesity in Mexico. So I had the honor to coordinate this effort, and after many meetings we were going to make a very, very strong recommendations, but then the government asked us to also include industry in the conversation. So they did not want a law, they want an agreement. So that's why it's called National Agreement of Healthy Nutrition. So it identifies the problematics, but it doesn't have the force in the language and in the actions, because it has to be in a consensus with industry. But these are the 10 objectives, and as you can see, it's very obvious, and those are the same objectives that any other country could promote. So first one, promote physical activity. Also, increase the consumption of water, decrease the consumption of sugar and fat in beverages. So it's not decrease the consumption of soft drinks or industrialized beverages, sugar and fat in beverages. Increase vegetables, fruits, legumes, whole grains, improve nutrition education, improve breastfeeding practices, decrease added sugar in industry foods, reduce saturated and trans fats, reduce portion sizes, and reduce sodium. And you see many of those have an asterisk, and that means we identified a lot of responsibility from industry to modify these objectives. Well, then there was a change in administration, and this was very complicated, and we ended up with 125 goals for different sectors: education, agriculture, economics, and then more than 300 indicators with time. So it was a very ambitious plan, and we were very proud. But at the end, with the change in administration and in political ruling party, many of this was dropped, and industry regained influence on the government. So now I'm going to show you some of the things we have implemented. Not much, because we don't have time, but one of those is one of the first attempts we did at trying to reduce obesity was trying to reduce consumption, and we think let's make recommendations for sugar sweetened beverage consumption. So this is healthy hydration recommendations, very similar to the one you have in the US. We made a paper, and it was like also with international researchers, many that were in the US recommendations, and we ended up with a paper that nobody read, obviously, and it was not important. But then we made this image that was saying water 6 to 8 glasses, and soft drinks 0 to half a glass, almost never. And what happened is this caused a lot of problems to the ruling administration. So we had like more than 250,000 posters to be distributed in the health centers, and with a phone call, the Ministry of Health discontinued the distribution to avoid conflict with industry. So what I learned is that it doesn't matter the paper, but this image is very powerful, because everybody can understand it. Like 10% of the people that doesn't know how to read in Mexico, they can understand this, but they cannot. Nobody reads this paper. The public is not reading. I don't think the physicians are reading it. We have endorsement from the medical societies, but still, this is one of the first things we do. The good news is that now in all the public textbooks in primary schools, together with the healthy plate, they have the healthy jar of hydration. And what I think is going to happen is that many of these kids, when they become parents and they want to give the best to their children, they will not give them soft drinks. But this will take like maybe 10 years or more, and industry have all the time to overcome this with their own marketing. We also were asked by the Ministry of Health, of Education, to do a translation of what of these recommendations can be done by the Secretary of Public Education. So we focus in these four: increase water availability. In many schools in Mexico, there is no water, not even potable water, just water. So this is a big thing in Mexico. This is not something normal or a minor task. This is a huge component. Also increase physical activity. We don't know how, but because it's only 4 hours, and then they need the space for the next shift. So it's not that they can stay there to do physical activity. The infrastructure is not there. Many schools have a very small space for physical activity, so it must be outside or in the schools that have full time. Then decrease the food marketing inside schools and increase the quality of food in schools. So this has been accepted and is now a law. So it's very good that now you don't find soft drinks in schools. Also, the soft drink company cannot paint the schools. Usually the basketball court has the advertisement of soft drinks in public schools all across Mexico. So this is now against the law. It doesn't mean it has stopped, but at least it is like one step before. Now we need to improve in enforcing the law. And some things that had happened since this regulation is, for example, that we have now a lot of junk food vendors outside the school. So this is what I was telling you before. The problem of obesity is not only of one sector. We need a lot of coordination. So it's not only to regulate the schools, but we also need to work with the local communities to have regulations so that junk food cannot be around schools. And this adds another a step of complexity to the problem. So we still have a lot to improve in schools. And the other one is food labeling. This, you all know this food labeling because you also have it in the States. It's called the GDAs. And the GDAs were created not by health professionals, but by industry. It was industry that decided that this was the way they want to inform the people about the content and the nutrient profile of their foods. And you know why? Because nobody understands this. I mean, I don't know if you think that this is a healthy product or not. It's not. It's a very unhealthy product, but it has like low levels, 1%, 9%, 80%, 5%. So even for health professionals as you, as many here, it looks like something that you could eat. So it doesn't help to understand or to take decisions about healthy foods. This is voluntary in the US and in many countries. In Mexico, the government make it a law. So by law, all products must have this. And this is not helping take better decision. Actually, it's confusing. We made a study, a very inexpensive study in nutrition students from one of the best universities that was to look at these labels and respond questions. And most of the nutrition students fail. So imagine in a country where there is a lot of problem with education, illiteracy, what could be the use of this kind of labeling? So the other problem is that they use a different level of sugar. The WHO recommends 50 grams of sugar per day at the maximum, and this is the maximum tolerable amount. And what this labeling makes uses 90 grams of sugar, so it's almost the double. So even if you understand it, it will be misleading because it is recommending a higher amount of sugar, and this is in the law. So we need urgently to take this out. This is what Chile has done, and I was mentioning at the start of my presentation that maybe you can learn not only from Mexico but from Latin America, and I admire this initiative in Chile. They have this octagons system that say high in sugar, high in fat, high in sodium, high in calories. And by law, all the products that have high levels, and the levels were decided by an expert nutrition committee independent of industry and free of conflict of interest. And they have this in all products. So now you have this paradoxic labels in which you have the fitness that is supposed to be fit, and it's a high in calories. And industry is obviously very, very mad, but this is the reality, and they have to live with this now, unless they are able to lobby with bad lobbying and remove it. But right now they have a huge success with this labeling, and we want to import it. We don't want to create a new one, and they are proposing colors and the stoplight system, and we think this is what we need, something that even without knowing how to read, you know that it has this octagon there is not good for you. If you can find one without it, it's better. And this is other thing they are doing. They are protecting children from very bad marketing, like characters. So they don't have anymore this label in the cereals. They have this one, and they still want to improve it. So I don't know. Maybe they will end up like the cigarette boxes that in Australia that are white and they don't have any color. Well. Not like that, but they are doing a huge improvement. So this is like you can find it in the US or Mexico without the octagon. So they have the two octagons and they remove Tony the Tiger. And that's amazing. And finally, the soda tax, which is something that happened in Mexico. This is a picture that was taken by a photographer from The Guardian, the UK newspaper, and she was surprised, and everybody when they watch this picture in Mexico, they are wow, and I say wow, this is in every corner, and it's part of the normal landscape, but when they say it in this picture, they are surprised. What we had in Mexico is we already made a very good evidence of sugar sweetened beverage impact on health, obesity, and diabetes from international meta-analysis and many studies. We demonstrated with our work the alarming epidemic of obesity and diabetes, and also we demonstrated that Mexico is the highest consumer of soda in the world with our information and with international information from the Sugary Beverage International Association. We also have a lot of support for the measure, but nothing was happening. And then the oil prices fell in 2014. They fell really bad, and the government was in a huge need of income. So they took the opposition initiative, and they said, well, if we take this initiative and we say this is, everybody will support it, and that happened. It was a battle that lasted about 2 months, but the ruling party was in favor of it. All the opposition parties were pushing for it, so it took by surprise to the industry. And also the NGOs were very well prepared to combat these 2 or 3 months, this short period, the initiative. So, you know, they have the most aggressive marketing in the world. They know how to do their job. They know where to place their ads. But they were not expecting this. The NGOs were ready and with very smart messages that very quickly created a lot of attention from the civil society. And I need to mention that Bloomberg Philanthropies was one of the main sponsors, not only of the research that was behind the evidence of the soda tax, but also of many NGOs, so they were able to pay these very expensive positions for their ads. The sugar industry also tried like the full page ad saying that soda hydrates and provides energy and is very good for you, and that the empty calorie is a concept that is unsubstantiated and the tax is not scientifically justified. But there was also a very efficient response from the NGOs. Look how many NGOs were signing this, and they were saying they represent more than 100,000 activists around Mexico, and they were saying not only it should stay, but it should be the double, not 10% but 20%. And also they put this congressman with a suitcase with money. So they say, and they say soft drink industry. So they say don't let yourself be bitten by like the mosquitoes of industry, something like that. So they were very effective. And also another lesson is we always that something happens in Mexico, they say, no, this is not good. Nobody in the world is doing it. Why you want to put a soda tax? So we had a lot of international support, and this was WHO making a statement. Then the Obesity Task Force, I remember I met Dina Hosher in the New York Academy of Medicine, and at that time we asked all this group, the International Obesity Task Force, to make a letter that was signed. I sent it to the NGOs, and they put it in the newspaper in first page. So the International Obesity Task Force was saying it's great to have a soda tax, and we congratulate the government, as the senators, and they also were proposing increase it to 20% if you can. And also in 2005, they tried to remove the soda tax in a last-minute initiative in the Congress. So we run also and got this from the World Health Federation. This is a letter saying that they were supporting the soda tax and that it was a very good policy that should not be removed. Now, since we proposed that the soda tax was to combat obesity, and I think that was a mistake, but we can talk of that in the questions part. But the industry and many opposition actors wanted us to show the effects of the soda tax on obesity, and that's a trap, because in 1 year you cannot show that. No? But what we were able to monitor, and we receive a lot of help from different universities, particularly from the University of North Carolina and Barry Popkin, is to demonstrate that there was a decrease in consumption. The soda industry was showing their figures of increasing sales. So from their figures, you could not say that this tax was helping to decrease consumption, and therefore it should be removed, because what is the purpose? Just tax Mexicans? So we published first article, and recently, just like 2 months ago, this article with evaluation at the second year, and there is an aggregated effect of 5.1 liters per capita in a mega country of more than 123 million inhabitants. So 5.1 liters per capita per year reduction with the soda tax. If you have a view of public health, if you have a clinical view, you can say, well, 5 liters for a person. But in the view of public health, if you multiply that for the million of inhabitants, and this is like hundreds of thousands of tons of sugar that is not consumed anymore in Mexico. So there is no any other policy in the world to prevent obesity with this kind of effect. So this is very important, and this is something that we were able to publish, and it has been very important to publish it in a scientific journal like the British Medical Journal, and this time in the Health Affairs Journal, because the industry pays like in 2 months for studies that demonstrate that the consumption is up, and that this doesn't have any effect, and that there has caused a lot of job losses, and so it's very important to have this to be able to respond to them. Now, this is a study that we made using this information in association with the UCSF, the University of California at San Francisco. And this is the cardiovascular disease policy model that they use to project benefits of health. But we adapted with Mexican information, and we use it to predict what will be the effect on health and in savings of the soda tax if we can maintain it for 10 years. And this is more or less the results. 190,000 diabetic cases could be prevented, 20,000 strokes and acute myocardial infarctions, 19,000 deaths, and savings of about $1 billion in 10 years. So this is also one of the parts that we are using with NGOs to show what is the benefit, not only health benefit, but economic benefit, at least in modeling. And I don't have to say this, but the same day that it was published, the International Association of Beverage Associations published an article saying that all this data is modeling and is misleading and is wrong. So it's scary, but they have the information even before you as researchers. They have it before. And this picture is, this is my institute, by the way. This is the door to my institute, and we just learned like 2 or 3 days ago that they put this ad outside. I don't know if it's on purpose or it's just like coincidence, but it's, we are very indignated. This is ConMexico, the main chamber of industry that is against our policy recommendations, and this is industry that supports and helps to the national income, so it has a lot of influence and respect in Mexico. Do you want to know how many of them sell sugar-sweetened beverages? And do you want to know who sell junk food in addition? It is. So this is one of the main actors that is against the policy, and with a lot of investment, with big bucks, with advertisements in TV. So this is very problematic. They ask to make a council, a national observatory of prevention of chronic disease, because they were concerned that the institute is becoming very important. So they want other actors to talk about the problem and decide the actions, the future actions. So they made this national observatory, and they are supposed to be the ones that decide on the policy, and all the ones in red are industry seats. So this is a problem of conflict of interest, and we are very concerned. The medical societies are do not have enough influence on policy, and the government seats are only 2. So we this is the only NGO that is not associated to industry that have a seat in this observatory. So we hope that with the change of administration, this observatory is down, and we are working in writing and demonstrating this in papers and scientific evidence. But not only that, other initiatives, such as the National Crusade Against Hunger, is sponsored by PepsiCo and Nestle. The National Program for Physical Activity, Ponte al 100, is sponsored by Coke, and the Casa del Niño Indígena, the House of the Indigenous Children, is sponsored by Coke. So I need to finish. I have the stop sign. Just to show you a good note, this is the environment in Mexico is improving. We have no beverage fountains with water for the dogs and water for the people. And we have some running lanes, one of the biggest lanes in the country. And these are, I think, the main recommendations for the U.S. One is obesity affects mostly disadvantaged groups, but society pays the price. So supporting vulnerable groups, population benefits everyone. And this is very important in the U.S. because you still have this problem. The Mexican Americans have even more diabetes than the Mexicans. So you need to you need to really support this. International collaboration is absolutely necessary to modify the obesogenic environment, because we have now free trade agreements and labels and different laws. So it's maybe easier for the U.S. to help us to try to moderate and to be more responsible socially for some transnational companies. So we need this cooperation and international collaboration. And obesity prevention requires interdisciplinary teams. So it's very important to have not only public health, but also social marketing, NGOs, public policy experts, good lobbying agencies. And when you see misleading information in the Facebook and in the social networks, just provide information and help, not only stay in your academic seat. Also, actions for global food and beverage companies to negatively influence and undermine local public health efforts must be documented and disseminated to make accountability for these actions a social norm. And this is happening in the U.S. As some papers have demonstrated how they are trying to affect public policy, and we need to follow with that kind of work. And finally, we need to become very good at preventing conflicts of interest to assure and protect integrity. And this could be one of the most important steps to curb the obesity epidemic in the world. So I think really conflict of interest, not only as something that we do to prevent our own interest, but as an area of research in public health of obesity is very important. And I think that's where some of the people in our group is going to devote their efforts in the next years. So with that, I would like to end my presentation. I really appreciate your attention and the opportunity to show you our information. Thank you very much.